so I didn't have to wait. But, you know, I kept saying, I don't understand that I had a stroke because I feel fine. I said, it's just my hand and my face, you know, some numbness. And I stayed, but what they said was they don't know why I had it again. And I said, I've been taking all my medicine, doing everything I'm supposed to do, but it's just happened. So I go to Yale, to the stroke center.
Okay.
And I just went last week, you know, every 6 months. And they're going to do some more tests. But what she was saying is that since I had two, like the third one, you know, could be, you know, devastating. So, you know, I said, well, I do everything you guys ask me to do. I don't want this to happen again.
That's right. That's right.
But the first
you have a little
one
bit
was
of interest
worse.
in this topic.
Yeah,
yes.
yeah. The first one was different.
Yes.
Because I didn't even know that I, you know, had a stroke until a month later. Because when I went to the hospital, I went because I had a bad headache. You know, the headache was awful. And it was to the point where I said I shouldn't take an aspirin and, you know, go, you know, lay down.
Yes.
Thank God I didn't, because I probably wouldn't have made it.
See?
But when I went to the hospital, my brain, they said my brain was bleeding. I had the brain bleeding and the swelling.
Huh.
And still, I just, they were asking me questions and I couldn't hold my head up by the time I got to the hospital. And they, you know, I said, please just, you know, check my blood pressure, because I said, you know,
Sure.
I know I have high blood pressure. So when they did finally take me to the back, they said, this is all I remember for that first day on a Sunday. She said, I think we have to do surgery. And I said, why? And she said, because your brain is bleeding. I'm like, what? But she never said I was having a stroke. So that's all I remember.
Boy.
But I was told that...
or cut.
So
we should plunge ahead now.
Yeah.
No, I say that cut, but just joking. Let's plunge in, because you're giving up some good stuff now. So you're on a roll. Let's,
Okay.
So
yeah, you're on. So we're done. Steph, we're done.
So
No.
I think that do you think that I can just reframe all first three questions and just kind of like, I don't know how to rephrase them, but
No, I would say go with
go
what you
through
have.
the questions.
Yeah,
Okay.
yeah.
Okay.
Sure.
All right. Let me know when you're ready.
And yeah, then you know, since we know Steph has she has information she'll be able to
Right.
Oh, yeah.
to embellish upon him. So yeah, we're ready when you guys are.
Okay.
Sorry. Do I need to introduce, or you're gonna do all that with the opening, whatever? Or just gonna...
Do you have enough information to introduce her right now, or not really? Because you can send it to me later.
Not really.
Okay, send it to me later. Yeah,
Okay.
we'll let people know what a fine person she is.
Absolutely.
A survivor, a thriver,
Yeah.
committed, like never before. Going to live to be 250. So we're good. Steph, do me a favor, just look up Steph's too. Just look up at Steph Button even when she's asked.
Okay.
Yeah.
Were you receiving regular physicals or checkups prior to your stroke?
Yes, I was.
Do you remember what went through your mind while you were having the stroke, or?
Well, actually, when I was having a stroke, I was unaware that it was a stroke. I just thought it was, you know, a very bad headache. So, no, I wasn't aware. I just was aware that, you know, the headache was really bad. It was something that I needed, you know, to go to the hospital about. But I didn't know I had a stroke until they told me a month later. Yeah.
Can you kind of talk to us kind of about what the process of what happened, you know, that whatever you remember? And...
Yeah, I remember it was on a Sunday. I remember I had a bad headache. So it was so bad that I said I should go to the hospital. So I actually drove myself. When I got to the hospital, they asked me, you know, how did I get there? And I said I drove. And they were like, oh my God. But I didn't know why they were saying, oh my God, you know, for just a bad headache. But it wasn't, what they did was they actually, you know, when they did the triage, they, you know, took me to the ER in the back, and they said, we think we have to do surgery on your head, on your brain. And I said, why? You know, I was very appalled. I'm like, why? And they said, because your brain is severely bleeding. And I'm like, oh my God. So I guess that was so traumatic to me that I don't know whether like I passed out or they, you know, gave me some kind of injection or whatever, but I don't remember anything after that.
Okay.
But it was the next day, I woke up and I knew that it was a Monday, and I asked them, you know, what time is it? And they said 9:30, and I said, oh my goodness, I'm supposed to be in a meeting. I mean, really.
Right.
And they were like, you know, and at that point, what I could say I could remember is, you know, they were asking me, you know, all kinds of questions. I didn't remember anything. Because they were asking me about insurance, what's the name of, where do you work, and what's the phone number, and at that point, I can say that I didn't remember any numbers, you know, at all.
Okay.
So a friend of mine is a nurse. She saw my name on the admitting list, and she came in, and she took over. So that's all I remember.
Has your lifestyle changed since the stroke? And if so, can you talk about how?
Yes, my lifestyle has changed. I was very active in a lot of committees. I was the president of the NAACP in New London when it happened. So at that point, at the time of the stroke, you know, I had to, well, they gave it up for me, of course. But yeah, it changed to the point where, you know, I don't, you know, go as many, you know, like take a lot of trips with traveling, because I've traveled all over the world. But, you know, in that point, I'm like afraid to, you know, do a lot of extensive traveling because of, you know, what happened to me. You know, you don't want to be in an unknown place and something happens, and, you know, the facilities, you know, or even, you know, people knowing your background, you know, trying to take care of you. So yeah, it's a change.
Okay. How about your any changes regarding like physical fitness, physical activity, nutrition?
Physical fitness, I could say, because you know, not because of the stroke, but I have a back injury, so I'm not able to exercise the way I should. But I do try to walk. I can't say that I don't. I do stuff in moderation, you know, walk. Do a lot of walking. So yeah.
And what advice, having gone through the stroke and all the rehab, and then you also mentioned earlier when we were talking, having had a second stroke that you weren't even really aware of, what advice would you give to community members?
Well, I would say stuff that I do is I go to the doctor on a regular basis, and definitely take your medicine, and don't skip, you know, the doses. Definitely you want to do that, and you know, just be aware of your body. You know, if you're having headaches, if you feel dizzy, you know, things of that sort. And make sure, you know, if anything happens, you know, like I had the numbness in my hand, and it took me a week to get to the doctor because, you know, I didn't think it was anything. I just thought I had slapped on my hand, you know, the wrong way, but it was the wrong thing to do. I should have went to the doctor immediately. So, you know, just knowing, you know, your body, and, you know, knowing when you should go to the doctor. It's important, very important.
Thank you very much for sharing your story and your surviving. I really appreciate it.
Thank you. Thank you.
So I'm going to have a conversation with Cindy Berry, who in 2006, at that time was the supervisor of the Health Education Department when they sought and received funding from the Connecticut Department of Public Health for a grant to reduce risk factors for heart attack and stroke in Black communities in our area. So thank you for sharing your perspective with us. I just have a couple questions about the beginning of the grant. What was going on in the community that led ledgelight to pursue this application for this cardiovascular disease prevention and to form the African American Health Council Southeastern Connecticut?
Well, I think that one of the things that happened was that the Department of Public Health for the state of Connecticut had released a report that talked about the burden of chronic disease, specifically cardiovascular disease, And the way that it was laid out really looked at the disparities between races. And I thought at that time that ledgelight Health District really wasn't doing enough to target its interventions to the populations that needed it most. The grant was released, the application was released by the State Department of Public Health. And also at that time we had a number of other coalitions where prominent Black leaders served. And so we kept hearing about the need to look at modifiable risk factors as it pertained to the African American community. So it was just perfect timing, I think.
And did you experience any challenges convening the African American Health Council of Southeastern Connecticut?
No, oddly enough, and that's not true for all coalitions, but I think what was happening at that time were that there were enough prominent leaders in the community who were experiencing heart attack and stroke. So one after another, we kept hearing about all these people that we knew were doing wonderful work in the community. And these weren't just old African Americans, these were young men and women who were hospitalized and were severely disabled by the experiences that they had. And had they had the information, they said that they might have made different choices.
Okay.
So there was enough surge of interest at that time.
And the work plan that ledgelight Health District put together for programs in the community, for publicity and other strategies, did you find that any challenges implementing the work plan?
I think that what was difficult was agreeing, looking at the data, and then trying to make sense of what was going on, and agreeing on some strategies because there were so many to choose from. I think that was the difficult thing. I think that the passion was there. I think that people were dedicated. They were in it for the long haul. But I think that there was so much to do at the beginning. Prioritizing was challenging.
Okay. How did you come to work with or find the leadership for the African American Health Council?
Well, I think that we wanted to start by reaching out to all of the Black churches in the area. And so I sent a very routine letter asking people if they knew of any leaders in their congregation, people that had stepped up that were interested in health, that were interested in health disparities, if they could please ask those people to call me. Well, a couple of days later, Ken Harris appeared in my office, having received the letter as a pastor, and said, "I'm your person. I'm the one that wants to lead this coalition." So it just happened that Ken was interested. We also had Jackie Massett, who was already on our board and a leader in the Black community, and so the two decided to co-chair this very important coalition. That we're not looking at the root causes, that it's not just enough to give somebody a prescription, but that person may not ever be able to afford to get that prescription filled.
Yes.
Or they might not have the support at home. Or although they're taking prescription drugs to help their blood pressure, they're still living right next door to a fast food restaurant where they're getting the majority of their food that's higher in salt.
So Steph, pose a question and have her look at you to get the answer. And actually, she doesn't have to pose a question. You can just start if you want. I mean, you know what you... Go ahead.
No, I was just going to say, I would love it. I wish we had just been taping the whole time and you could have just framed my junk out because that's a perfect segue, because I was trying to figure out how am I going to start talking about this legacy thing and the equity stuff that we did.
Right.
And this was perfect.
So ask her, how can you start talking about the legacy and the equity stuff? the ramifications, the implementation.
Okay.
Yeah, that's good.
What more can be done? Raising awareness outside of the programs that we've done. What more can be done to have better outcomes regarding cardiovascular health, and not just in the Black community, but just overall?
Well, I think that you're on the right track. I think that by educating people, by screening people, I think that that does a tremendous service to individuals who are wanting to make good choices about the decisions that they make that impact their health. But it needs to be broadened. There needs to be some things that are complementing those individual kinds of programs by looking at the conditions in which people live. That it's not enough to help somebody to understand that intaking sodium has an adverse reaction to their blood pressure. And if they're taking medication, that's great. But if they're living down the street from fast food restaurants and they don't have access to fresh produce, then it seems like we're falling short.
So what do you see as other things that we, as both the health department and coalitions like the African American Health Council and other coalitions like the Achieve Coalition that you oversee, can do to improve those conditions?
I think that one thing that helps to reduce health disparities and health inequity is to look at policies that affect the majority of people in a community, and to make sure that we're all on an equal playing field, that we all have access to fresh produce, that we all feel safe in our community, that we all have opportunities to quit smoking and not to have access to tobacco, that our communities change to protect our health, and that we'll find if we design our communities in a way that does that, the rest will follow, regardless of what population you live in.
Perfect.
In 2009, ledgelight Health District applied for and received funding from the Boston Public Health Commission to discuss the social determinants of health, but in a different way, a different context. And so they gave us this framework to work with, which has the social determinants of health listed down the middle: social capital, education, transportation, employment, food access, socioeconomic status, environmental exposure, health behaviors, access to health services, housing, and public safety, and how they impact your health outcomes. But the lens that they wanted us to kind of view this through is through institutional racism, how that impacts the social determinants of health, and how that in turn impacts your health outcomes. And so what the African American Health Council of Southeastern Connecticut decided to do was work with residents who live in the Thames River apartment complex on Crystal Avenue. It's a 3-building high-rise complex. It's home to about 125 families, low or very low income. The bulk of the families are headed by single parents, mostly women, and most of the people are employed, but have minimal, not to cut that, just where we decided to do the project.
Yeah.
So the African American Health Council of Southeastern Connecticut members decided to work with residents at the Thames River apartment complex on Crystal Avenue, which is a 3-building high-rise complex, and it's home to 125 New London families. So it was difficult initially to kind of get buy-in with the residents because I didn't have a way in. And I think maybe initially we were kind of viewed as going to point fingers at housing and going to, tell all the residents how bad they were for, the health outcomes, all the data that's already been reported out. And it wasn't about that. It was really about looking at what is happening now, what the resident priority is, and what we could do to work together in partnership to improve conditions so that their health outcomes are improved. And so we finally were able to meet with some of the residents, and one of the first exercises we did was discuss the social determinants of health. And so I listed all of these. I had a piece of paper on a board, much like these pictures, and asked them how each social determinant of health impacts their health. And then we did a priority exercise, and in the end, environmental exposure ended up being their priority issue. And it was really important to get their perspective because as far as I'm concerned, it may have been something entirely different, but I don't live there, and I don't have that particular lived experience, so it was really important to engage the community and find out what their priorities were. So the next exercise we did was kind of a photo voice project where each of the residents was giving a disposable camera, and we asked them to do some community mapping. And so we asked about things that they thought could be improved, but also assets in the community. And so there are structural issues because the complex has been in existence since about 1967. So there are definitely structural issues, and the Housing Authority is doing the very best they can to maintain the properties with very limited resources. And so the first couple of pictures show, you know, holes in the wall where mice can come in, and so residents have had to purchase some kind of substance, which this particular resident calls goop, to kind of stop the holes up to keep the mice away. This particular photo is right outside of her food pantry, and if you can see, there are several mouse traps, and that's needed because, again, there are holes in the walls. There's a large garbage disposal system that runs through the entire building, and as you can imagine, there are, you know, a certain number of families on each floor, and if a large item is placed in this disposal system, then it's going to be backed up, and then you have all the rodents and the roaches, which is also a persistent problem in the area. This is the same person's area where she stopped up the hole. This is the other side of the food pantry, and she'd gone away for a weekend. And I know you probably can't see it, but there's actually a dead mouse that's actually on this trap. And so we're working with housing to kind of figure out strategies and ways to alleviate some of the environmental exposures. This is just another picture a resident took of a trip hazard, which is outside. And this picture is of a gate that is all the way around the complex. And
remember to look here.
we also asked residents to take photos of what they saw to be as community assets. So one of the first ones that I thought was very interesting was the picture of the New London Public Library, a source of information, events that are happening throughout the community. And residents had previously said that they felt kind of disconnected from the community, like they're isolated in this little pocket of New London. And so to have them see the library as a source of connection was really good. And the other asset that they described was twofold: themselves, meaning their little personal, networks within the community, their smaller community of New London, and their children. And so these other three pictures are pictures that they took of their beautiful children, who they see as assets. And they were very interested in being part of this legacy project, so that they could leave a better legacy for their children. And this last picture over here, probably after the kids, was one of my favorites, because it's a picture of a highway sign to I-95, which actually runs right over where the complex is seated in New London. And one of the residents said, "Are we ever going to get out? Or this is my way out." And so we're talking about creating
What's that?
This last picture is one of my favorites after the pictures of the kids. It's a sign leading to the interstate, which actually runs over the apartment complex. And one of the residents, when I asked, what was going through your mind when you took this picture, she said, "This is my way out." And we kind of broke that down a little bit, and it wasn't just about not living in Crystal Avenue, the high-rise, the Thames River apartment complex high-rise any longer, because you can still live there, but be living in a way that you don't feel trapped there. So we got into a deeper conversation talking about maybe goal setting, things like, I have to live here, this is where I am right now, so what can I do to improve things where I live? an example is if I feel like all I have is my high school diploma or my GED and I want to do something more, how can I improve my education? So what are the resources within my community, within New London, that will allow me to increase my education level and perhaps my earning capacity? And then maybe if moving out is something that happens as a result, so be it. But if not, now I've improved my standing. If living here, I am surrounded by convenience stores and liquor stores, what can I do to improve my access and that of my community to more healthy choices, fresh fruits and vegetables? So maybe I need to talk to the mobile market that brings it and having them put us as a stop. Maybe we talk to the local convenience store owners about adding some fresh fruits and vegetables to their market and making sure that, you know, we are committed to purchasing these. You know, once they get them, we have to actually go and access them. Or talking to someone about improved transportation or, you know, something along those lines. So a way out doesn't, again, necessarily mean just moving out of there, but really transforming how you live where you are. About the new day and a new chance. And my mom's Bible study last week was about what you're going to do with this new 24, the new 24 hours. What are you going to do? Are you living in your purpose? Are you living like, you know, just, wow, connection.
Good.
Okay,
Good.
sorry.
Good. Thanks. That's fine. We're all set, Reverend? Would you like a glass of water?
No, I'm fine. Thank you.
All right, so
Great rehearsal. Excellent.
should I do?
Little intro
Did I
would be
do
good.
an intro? Okay.
Little intro on that.
So, Reverend Herman Pollard, co-pastor at In His Presence Ministries here in New London, Connecticut, and member of the African American Health Council, Southeastern Connecticut, from the very beginning.
Yes.
Thank you so much.
Yes.
And also a heart attack survivor. So I really appreciate you coming today to kind of discuss your story and your survival and advice for other people in the community. I really appreciate that.
Amen.
So prior to your heart attack, were you receiving regular physicals and
Yes.
checkups?
I you know, like I said, my son graduated in '85 from UConn, and I said I want to be around to see him graduate. He's got the UConn degree, but I said, if you're going to be a lawyer, I want to be around. And for me to be around, I had to take care of myself physically. And God saw fit for him to graduate from Yale, magna cum laude, and I was at his graduation. And I dare say I would not have been there if I didn't. And it's not because I thought so highly of myself that I want to look just right. And be, no, it's not about me. It's about being there for him. And that's what I did do, and I don't feel any regrets. The only feeling that I have right now is sometimes I feel a little paranoid, and if I have a pain or something, that where that come from? I check it out, and then if it stays too long, then I go to a doctor about. Like I've been out sick from work last week, but and then only in a couple of days ago that Thursday I went to the doctor and said, well, no, my cold is hanging on too long. I need to do something about it. He gave me a Z-Pack. He says, you know, he gave me a physical, said, you're fine. He said, I'm glad you came in. I said, yeah, because it could turn into pneumonia. And you know, I had a couple of friends who died from walking pneumonia, and they're just fine. I saw them one day, next day they're gone.
Right.
What? And so it's not, and it's okay to be paranoid for a good reason. To be paranoid, just to be paranoid and do nothing about it is ludicrous.
Prior to your heart attack, were you accessing health care through a provider on a regular basis, like regular annual exams and things of that nature?
Yes, from the same doctor that I had gone to, to make sure that I would be around for my son, the same doctor. And the real reason why I went then prior to that is that when I was working at Pfizer, I was working swing shifts a lot, and it's a toll on your physical self, you know, and so my blood pressure would escalate. And one time I said, oh, I know this is fine. But one day I was walking out supervising, and I felt so dizzy. I said, ooh, wow, this is not wow. And so then I went to the doctor, and he said, well, you need to be on BP meds because your blood pressure is high. Wow. And said, well, sometimes it's genetically involved, and sometimes it's not. But we can't assume anything. Right. I mean, we can't assume anything. So I just, in other words, to really be around for my family was very young then, to be around for them, you have to take care of yourself. Who else is going to do it? Right. If you don't do it, who's going to do it for you?
Right. Thank you.
And God calls us to be wise, not to be foolish.
Yes. So can you kind of take us through the heart attack, the experience? Like, do you remember what was going through your mind before and during the heart attack, and maybe what it felt like, the whole experience?
Well, you know, before, see, I never thought it was a heart attack. I just thought that I wasn't feeling well. I had this flu or something. Mm-hmm. But when 911 was called, and I remember getting in the ambulance, and I remember, and then my wife in the meantime had called your mom and called all the clergy. So when I got to the emergency room, the place was inundated with clergy. And then by that time I had woken up, and I just thought I just fell asleep. And so Dr. Fazio met me. The doctors met me as the ambulance was pulling up. So and then he looked at my wife. He says, we just barely got a pulse now. He says, this does not look good. Mm-hmm. And so then everybody began praying. Mm-hmm. You know, prayer changes things. I'm not saying that all you have to do is pray, right. But if all I did was stay home and pray without doing anything, I would be talking to you now. Yeah. So God wants us to pray and move and do something. And so we did something.
Excellent. How has your lifestyle at all changed? And if so, in what ways has your lifestyle changed since the heart attack?
As
far as maybe physical activity, as far as maybe your level of involvement in the community, nutrition, like. Well,
you know, since then, since my heart attack had made me very, very aware of my body. Mm-hmm. It made me very conscious of not all the time, what is that pain, because I don't have that much pain, but if something else is going on, I just pay attention to it. And number two is that it made me get more involved. Since my heart attack, I have graduated from Atos Bible College with my BS degree in theology. Mm-hmm. I graduated from there, and that was prior to my, so that didn't affect me. But I knew I had to do what I really wanted to do in life and what pleased God. And my focus was on pleasing God, and my life was to do what made me happy. Like I said, playing the piano, I thought that was my thing, but it really wasn't. It was an enhancement, but it was not it. It was not it.
And what advice would you give community members moving forward? And I'm going to actually take this a step further. Mm-hmm. What advice would you give men in our community regarding being proactive about your health? What advice would you give?
I would say to men that they need to stay focused on your purpose in life. Mm-hmm. Your purpose is, life is not to be a macho person creating babies all over the world. Mm-hmm. An animal can reproduce. You need to know that there is a reason why you're here. There's a purpose for your life. You know, you just didn't happen to be here because God had nothing else to do but say, I think I'll make a Herman. So when he made a Herman, though, he had a goal in mind for my life. Mm-hmm. And it needs to go back to God to honor him. I would say to men, stay focused, and you're in a relationship with a woman, you need to know that it is a God-given thing. he who finds a wife finds a good thing. I don't know. I don't go for this new generation. I'm going to get an apartment with my girlfriend. We're going to live together. No, because a lot of times when that happens, there is no responsibility on the side of the man. He feels as though if I don't get along with her, I get up and leave. Well, that is disrespecting the girl that you're with and it cheapens your life. And it also leaves you wide open to diseases too. In reality, you are just as safe as the last person you slept with, and you got to really know what you're doing. It's not about you. You can't get so caught up in saying, "Oh, I'm this. I'm a great piece of work. I'm marvelously and wonderfully made." Yeah, in God's sight you are, and you always need to believe and understand it is because of the grace of God you are who you are.
And also, regarding particularly men's health,
be proactive. Be proactive. You need to just know that because what you are doing is appears to be for yourself maybe, but you got to know that it's not about for me. It's about because you can be in good health and it makes no difference. But if you love your wife, if a woman loves her husband, she'll take care of herself just for him, just for her, just for your children, just to see your grandchildren. And before I had my heart attack, I had 2 grandchildren, but they were very, very small. But since then, I've got 2 more, which didn't happen before I had my heart attack. And now it's just a pleasure to see my small grandchildren, and because they and it's so funny how God works. My wife, before she died, my second wife, not this one, my first wife. Before my first wife died, we didn't have any grandchildren. She never saw our grandkids, never saw none of them. And we always said, I can't wait until our grandkids get here. So my wife died and she never saw them. But this is how good God is. My granddaughter, my oldest granddaughter, 16, graduating from Mercy in May, magna cum laude, going to Harvard, and has never ever seen her grandmother, but she looks just like my wife. And my youngest granddaughter, who is 2 years old, acts like my wife and has her color. And I said, oh my goodness, so good how God works, So, and it all boils down to that very real, the reality of it is that you got to take care of yourself to do what you have to do.
Thank you.
Amen.
Thank you.